Hi, good afternoon, everybody. Today we are very honored to have our San Jose former Vice Mayor, Rose Herrera, joining us to talk a little bit about what she's been working on during this interesting period we're living in COVID-19. Rose is a long-term friend of ours for many years. She's served 8 years honorably on the San Jose City Council. But before that, she actually has a very long, distinguished career as a businesswoman herself, started a business, and also served in the United States Air Force as an Air Force veteran as well. So we're very honored to have her come and speak with us today. How are you doing, Rose?
I'm doing great. Thanks, Otto. Really happy to be here, and hope everybody out there is having a wonderful Memorial Day weekend with family and staying safe. And I just want to say I appreciate, Otto, that today for this interview we're wearing masks. We're showing people here the importance of making sure that we're safe by covering our nose and our face when we're outdoors. And I think it's a good demonstration of what everybody should be doing, and I appreciate that you're doing it.
Right. Thank you. So Rose, tell us, well, with this Memorial Day weekend, as you know, the Oak Hill annual memorial ceremony has been canceled, but I believe there's still another Zoom or type of online.
Well, actually what we did, and we are asking everyone who can hear this, if you hear this before Monday, there is no on-site Memorial Day event at Oak Hill. So please do not go there expecting to be a service. We really would appreciate that you check it out online. It's going to be covered by ABC News. ABC will run a 10-minute presentation, approximately 10 minutes, and then there's going to be an online presentation done by United Veterans Council, of which I'm the vice president of that organization. And so we filmed that on Wednesday at Oak Hill. We had a few people come and we did some filming. So there is going to be a ceremony for Memorial Day, but it's going to be virtual, as a lot of other things are. We've all come to accept that. And we hope next year we'll be able to come back to Oak Hill in person. We all hope and pray that that's the case. But this year, look for us online. And just wanted to say that it's very important that we celebrate Memorial Day, because as I think most everybody here knows, Memorial Day is honoring those who pay the ultimate price for our country. And of course, Otto is a very distinguished veteran. I don't remember your whole career, but I do know that Otto played a key role over there in helping get equipment, logistics. He was in charge of it, and boy, do we know about logistics now in this pandemic, how important it is to make sure that we have things, equipment and PPE and all the kinds of things our medical people need at the right place at the right time. That's what Otto did.
Yeah, we were moving things over there, but when I got there, we were actually moving things out, trying to draw down so that people can get home sooner.
Yeah, so you helped them get home sooner. But anyway, thank you. I just want to thank you for what you've done for our country. I really do appreciate that. And again, Memorial Day is really significant, everybody. It's you're going to see tomorrow flags flying at half-staff to honor the almost 100,000 people who have died in this pandemic. It's really sad, and I think people should not lose sight of the fact that we have lost 100,000 of our fellow Americans to this. And if you think about 100,000, that would be the entire district of Evergreen. Can you imagine losing an entire council district? That's what we've lost in this country. So tomorrow, please think of those folks, think of the ones we've lost, think of the first responders that are putting their lives on the line every single day in this pandemic. It's still going on. Just because we're having a weekend and it's sunny doesn't mean this virus has gone away. It's still out there, and we're still fighting it. And so tomorrow, if you see those flags at half-staff, that's what they mean. And then on Memorial Day, we'll be honoring, of course, all of those men and women who gave their lives in service of our country for all wars throughout the history of the United States. But we also will pay homage to those people who are fighting this pandemic too. It's appropriate to do that because many have considered it a war. It is a war, and we're fighting hard to win, and many people have given their lives in service of our country, and some of those are military out there. Our military are still serving even in the middle of this pandemic. They're on ships, they're out in the field, they're everywhere. They're part of our National Guard. They're delivering food. They're helping, they're helping with on the medical ships. They're doing everything they can to help us win this. So it's a very, very important weekend, and I think it's an important weekend for all of us to take stock, to think about this, to prepare ourselves, because if we're looking at this as a battle, we're not even a quarter of the way through this. It's only been a few weeks, and we've got a long road to go. It's a marathon, not a sprint. And so I hope people will think about how to prepare themselves for the summer, for the fall, and for next spring, because we've got several more months ahead of us in terms before this will be anywhere near over, before we have a vaccine, before we have treatments, and we have to stay vigilant. We have to wear the mask, we have to keep distance, we need to keep washing our hands, but especially, if I could leave one message today, please wear a mask when you are around other people. There's been stats now that say 75% of the transmission could be reduced if people would just wear masks. So if you want to get out and do fun things, if we want to get all the businesses open, if we want to be able to go to the beach and socialize and do all these things that we want to do, make sure that you keep that distance, and that when you're near other people, wear a mask. That's how we can come back to normal more quickly.
What can the normal residents or anybody can do to help our veterans during this difficult times?
Well, I think if you see a veteran, if you see somebody wearing a hat or wearing, acknowledging that they're a veteran and thanking them for their service is a big deal. Veterans, a lot of veterans, especially, some of our older veterans who maybe were part of the Vietnam conflict, came back to not a very warm welcome when they came back to this country. And so just acknowledging the military, and what's really nice is a lot of people are doing that now. They're saying, thank you for your service, sir, and just acknowledging people goes a long way. I think that there are specific groups of veterans that have needed help more. We know that there's a percentage of veterans that have been homeless, and many people have reached out to help those individuals to find shelter for them. Especially now is really important to help our homeless community members. So there's a lot of things that are being done. There's lots of organizations. UVC really is kind of a clearinghouse. We try to work with the Veterans Administration and other organizations that do more direct assistance. One of the issues now with veterans is, and we have had this, all along, is we have vets out there with PTSD. And before, where they could go to their groups in person, now they're having to do things over Zoom. They don't have the ability to reach out to each other. And so that isolation is something that we're really trying to combat. So a lot of us are picking up the phone. We have lists of veterans. We make calls to them to make sure that they're not isolated. Right. We make sure that they have masks. We make sure that they're getting food. The VA has instituted a program that's going to individual veterans. So those are just some of the things we're doing.
So if individuals have a donation they would like to make, whether it's cash donation or donating masks or gloves, can they contact UVC?
They can go on to our website and reach out to us that way, and Great. We'll direct them to the right.
Great, and we'll put the website. What's the website again?
It's uvc.org.
Perfect. Great. Now, in terms of the those who are suffering in our community, those who are, I'm sure you have seen in the food pantry that the need of food has just been skyrocketing. What would you recommend people do?
Well, I think donating, first of all, we recognize that there's a lot of unemployed people, a lot of hurting people in this city and in this county and this country. So a lot of them are not able, are actually lining up at those food pantries. People who've never used them before are looking for places to supplement their food. So we recognize that, first of all. But if you still have a job and you have means, please, financial donations are really important so that they're able to buy the food. But there's been lots of creative things that people are doing, donating food. There's lots of food campaigns on. I know the mayor has a big campaign, the county has a big campaign going on to donate money and resources to help people. Volunteerism, they need volunteers right now. I think the county is recruiting folks to do tracing to help with the pandemic. So there's lots of different ways people can volunteer. Either volunteer their time or donate money or donate goods.
As you know, California is one of the states which has started the shelter-in-place, one of the earliest in the nation. And as we know, that has of course saved many thousands of lives by doing that earlier than the East Coast. What are the criteria do you believe will be necessary to be established before we can open up again?
Well, I'm following the healthcare experts. The public health people are the ones that are best able to advise us on that. But I think one of the things they've said is to make sure that, they're looking at numbers. They're looking at what the hospitalization rate is, what the spread is, how fast is it spreading. They're looking at R0 numbers. They're looking at all of those things in general to see how the virus is in a particular area. But as an individual, I think the things we can do are do the things they've asked us to do, which is wear a mask when you're out in public. That is probably the number one thing we can do. Mm-hmm. Now we've learned recently that, a lot of us were probably overly concerned with packages coming into our homes and things like that. Right. I'm not saying you shouldn't wipe them down, But if you want to put it in a hierarchical order, the most important thing to do is cover your mouth and your nose and your eyes. That's what's important. That's where the virus comes in, and that's how it transmits. And so as long as you wash your hands and don't touch your face, it's, you know, whatever you touch, you can still wash your hands. But if you breathe in, if you breathe something in, if somebody sneezes near you, coughs near you, and you breathe that in, or you're in a room, in a closed room, it's even more important in a closed room, and you're exposed to somebody with COVID, and 35% of the time they don't have any symptoms, so they could be walking around looking like nothing's going on with them, and they could be spreading COVID. That is why we need to wear the mask, because you're not going to know whether somebody has it or not. So you have to assume everybody can have it, and therefore you have to protect. If we do those things, we can really, really help our public health officials. And it's really up to us. It's up to each one of us as to whether or not we can maintain some ability to go out, some ability to go to businesses, some ability to go eat at restaurants, outdoors. I would advise to do a lot of the stuff outdoors, not indoors. But, you know, the more that we cooperate, if we can get 80-90% of the people wearing masks and cooperating, we're going to be able to be a lot farther along than other states that we see are not doing that, and they're having huge increases right now. We're seeing that in the South right now. So California's doing a great job, and I just want to commend everybody. This state, this area has done a great job in complying, but we need to keep going, because a lot of us will get tired of it. And we'll think, oh, come on.
Fever, right?
It's hot weather, man.
Beautiful day.
Doesn't this hot weather kill the virus? You know, I wish it did, but no, it doesn't. It doesn't.
You have in the Philippines, you have in Indonesia.
Yeah, it's all over in very hot weather. So no, it's lurking around, and it's not. The virus is going to continue to go through the society until it hits about 60 to 70% of the population. And you don't want to be one of those 60, 70% that gets infected with this, because it's rolling the dice. You just don't know whether you're going to have a bad case of it or a mild case of it. So I just strongly encourage everybody, please look out for yourselves, look out for your family. When you wear that mask, you're protecting children, you're protecting your grandparents, you're protecting health workers, you're protecting people who work in the grocery store who don't have a choice. Those folks, you know, if you're a tech worker and you're working at home and you're doing all your Zoom meetings, you may be having a wonderful time. But there are plenty of folks that can't shelter at home. They have to drive the delivery van that brings your groceries to you. They have to go work at the grocery store where you go pick up the groceries. They're exposed to people all day long. And if you don't care about yourself, please care about them, because they don't really have a choice.
That's right. Exactly. Great. Do you have any other area you would like to talk about, Rose? No, this is great. No, but it's good. Any specific area you would like to also bring to the audience?
Well, I think the thing that I'm most concerned about right now is for us to get through this crisis. Because the future of, definitely the future of our area, the future of our state depends on how well we come out of this. It's not insignificant. We could be facing a Great Depression again if we don't do this right. And if we do it right, you know, we could maybe escape some of the worst of it and have people come back. So I support creativity. I support the idea of having businesses do their business outside. So the City Council in San Jose just passed an al fresco ordinance, and they're going to support restaurants, and I mean, you name the business. If you get creative, I think somebody could teach yoga outside. You could maybe get a haircut. I mean, can you imagine somebody puts a barber stool out there and does a haircut? Why not? You know, I think the businesses then can get very creative, and folks can help them by patronizing those businesses, and it's a lot safer than if they have to figure out how to do everything indoors when they have to cut 25% of the people that are in there for restaurants anyway.
I did hear there was a saying that says that the 2020 should be uninstalled so we can reinstall it, because they heard that there's a virus.
That's a good one.
We hope it's that easy, right?
Yeah, I wish it was that easy. Yeah, that's true. Yeah, unfortunately, no. And then most of the country probably wouldn't even get that joke, Otto. That's a Silicon Valley joke.
There you go. Well, sometimes in these times you just have to laugh, right?
Yeah.
As they say, laughter is the best medicine.
Yeah, I mean, I think definitely just because I'm advocating taking this seriously doesn't mean you don't stop living.
Exactly.
You know, we need to have fun. We're outdoors. It's a beautiful day, and you can do a lot of things and still mind the rules. You know, it's not a huge thing.
No. And it's just so important to patronize our local businesses like restaurants, where they're still cooking very good food. So I know a lot of people were doing a lot of cooking before and probably tired of cooking, doing the dishes. I advocate that they should try more takeouts of different cuisines around the neighborhood, because especially here in Silicon Valley, we certainly have no shortage of different cuisines of all sorts. And I really do think that we need to patronize those businesses to try to help them through this tough times.
We do, and hopefully now we've moved into phase 2. Santa Clara County finally did, so there'll be more opportunities to support those businesses.
Exactly, and you can do takeout orders and bring it home.
Get
and
one today.
Yeah, there you go. Exactly. Great. Well, thank you very much for coming out speaking with us today on a beautiful day with the background of the evergreen hills right here.
Those hills are gorgeous.
Isn't it gorgeous? The wind's a light breeze. It's a really beautiful day, and so many people are still staying home, saving lives, as you said.
Well, and they can get out and walk. There's no reason why you can't get out and walk. If you're completely by yourself, you don't have to wear the mask. But I'll tell you what my experience has been. I'm walking, I think I'm all by myself, and all of a sudden somebody comes up to me coughing and sneezing with no mask on. So you have to decide, whether you think whether it's an area where there is nobody around. But there's a lot of people around, and unfortunately a lot of them are not wearing masks. So just be safe, everybody. Be safe. And
keeping our 6 feet distance.
We're keeping our distance. We're following the rules. It's not that hard to do. Just think what our previous generations had to do during the Depression or during World War II or previous things that people had to go through. This is actually a very small ask for this generation to wear a mask and save lives.
Right. I think 1918 pandemic, it lasted like more than a year for people social distancing before it's over.
Yeah, they lost millions of people. It was really, we don't want to repeat that one.
Absolutely not. Well, again, thank you very much, Rose, for coming and speaking with us today.
Thank you,
and thank you, everybody, for paying attention to this very important topic. And I would like to, again, thank Vice Mayor Rose Herrera for taking time today to talk.
Thank you, Otto. Thank you.